Should you do Kegel if you have incontinence, either urinary incontinence or fecal incontinence? That's the subject of this video. So we're going to go over Kegel exercise, what that seems like. Can you do too much of it? Can you do not enough of it? The answer is yes, by the way. And then what are some of the options available? Stay tuned. Hi, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, and I'm going to discuss what Kegel is all about. Just to understand it, I don't encourage you to do this often in the bathroom, but to understand what muscles you're contracting with Kegel exercise, my suggestion is when you're in the bathroom and you're urinating, as an example, kind of squeeze to make the urine flow stop, and then let go, squeeze and let go. That's not all of your pelvic floor muscles, but you kind of get a concept of what that feels like. You can do the same thing, only not necessarily having to go to the bathroom, but kind of squeezing your anus. That kind of contracts the floor, the muscles within the bowl of your pelvis a little bit better. So that's just for you to understand what that even feels like. Now, Kegel exercise is not good for people who have more of a spasm of the muscles. So you can't, and that's a mistake that people make, you can't strengthen a muscle that's in a spasm. So the first thing that has to happen is actually relaxing the muscles. So in cases of spastic pelvic floor, the only way you can actually approach it, and the initial concept of treatment has to be through manual approach, through the vagina and or anus, to go in and actually with biofeedback and with other breathing techniques, things like that, you get to really relax those muscles. Then you should do Kegel. A lot of times people do too much Kegels, and unless you have a requirement and your condition necessitates doing Kegel to the extreme level, you shouldn't go crazy and do like 30 minutes of Kegel every day for the rest of your life type of situation. So it's maintaining it is a good idea, but don't go overboard. Now, in our office, we handle a lot of patients with pelvic floor dysfunction. I've done a video on what pelvic floor dysfunction is. It is more than just the pelvic floor muscle weakness. So we're going to put a video at the end of this that explains what pelvic floor dysfunction is all about to begin with. But in those cases, when there is no spasm of the pelvic floor muscles, we use this machine called emsella. That is not in every office. In fact, when I checked around, there are hardly any offices, certainly no therapy offices, that have the machine. But the machine does 400 Kegels a minute. So that's quite a few Kegels. If you can do one, you know what I'm talking about. So when you're sitting on the machine, it actually feels, with the different setups that we have, it actually feels like the muscles inside the pelvis gather up and lift, gather up and lift. So it's all of those muscles working together. In nature, when you're walking quite a bit, those muscles get the practice. Unfortunately, in today's society, we don't do that as much. So a lot of times people have pelvic floor dysfunction without even realizing it. So Kegel is not for every kind of incontinence, number one. Number two, for maintaining it, don't go crazy doing so many of them. And if it is necessary, I really think it's not happening enough. That's why we have this machine. Once again, that's a case-by-case basis. If you have any questions about what I just shared with you, or even about the machine, just contact the office. One of the methods of contact is in the description box, and make sure you subscribe to the channel, because that's how this whole channel is dedicated to pelvic floor dysfunction. Thanks for watching. Take care.